All right. Hello, everybody. Thank you for joining us for this quick update from our practice, New York Hearing Doctors, the Institute for Hearing and Balance. We're going to be streaming this live on Facebook, and it will also be streaming live on YouTube. But if you happen to miss any part of this, you can watch the recorded version of this update on either platform anytime in the future. So the world has been an interesting place over the past couple of months. I think that's an understatement. Most importantly, before we get started, because of what's been going on, we really hope that we're finding you and your families healthy and safe. It's times like these that remind us all of what is truly important in all of our lives. So we want to make sure that we start by saying that we hope you guys are all well out there. So we made the decision to close our physical office on March 16th. So we're going on a little over 2 months now. There were many unknown elements as it relates to the coronavirus at that time. So we decided, and we made the early decision to close to protect our patients as well as our staff and everyone's families. Now, looking back, it was the absolute correct decision to make at that point. Although we're learning now that COVID was likely in New York City as early as January into February, perhaps even sooner than that. So that decision to close that second week of March was also shared by most of our medical colleagues in and around Manhattan. So it made the decision much easier for us just to understand that they were making the same decisions as well. Now, although our physical office and even the building that our office is in has been closed since that time, we've all worked very hard behind the scenes communicating with you and every other patient that we have, a lot of patients every single day. It was our priority to make sure anyone who needed us during this time was able to reach us. So as a result, during the past couple of months, we've conducted many, many telehealth sessions to answer questions, to help people troubleshoot their hearing aid issues, and also get much needed supplies out as quickly as possible. Now, there's certain things we haven't been able to do remotely. We do have a lot of equipment that's in our office, but anything that we could do for our patients, that's what we were focused on doing during these troubled times. So now, as we look at the COVID cases being on the decline in New York City and around the area, the reality of the virus is still with us. It's not going anywhere anytime soon. Now, keep in mind that our group has always practiced universal precautions as well as a very high level of infection control. But due to the coronavirus, we've implemented some enhanced infection control protocols in our practice to ensure that you as the patient, as well as our entire team, are safe when anyone is within our practice. So as we prepare to reopen our doors in the upcoming week or so, you're going to notice some necessary changes to how we communicate with you, and then ultimately of how we provide care to you. So we'd like to spend some time today providing some details on what you can expect, just so there's no surprises. So first, we're going to have Dr. Ariella Naeem talk a little bit about what to expect prior to your appointment. Then Dr. Alexandra Zweig will talk about what to expect when you arrive for your appointment and what happens actually within our office once you're there. And then finally, I'll wrap up with some very interesting services that we're preparing to offer you, some being available as soon as we reopen the doors. So with that said, I'm actually going to bring in Dr. Ariella Naeem. How are you, Dr. Naeem?
Good. How are you? Hello, everyone.
I'm doing great. I hope everybody out there is doing great as well. So what I'm going to do is I'm going to step aside. I'm going to let you talk a little bit about what they can expect before they enter our four walls, basically.
Sure. Hi, everyone. So like Dr. Casper mentioned, I'm going to discuss a little bit of the steps that we are going to take and the questions we're going to ask you before you actually step into our office. When you call to schedule an appointment, you're going to be asked a series of questions, and we'll determine whether you need to come in to see us into the office, or we can help you over a telehealth appointment. If we determine that you need to be seen in an in-office, in-person appointment, we're going to ask you a series of COVID-19 related questions to determine if we can proceed with scheduling that appointment. And these questions will include, have you been diagnosed with COVID-19, or have you come into contact with anyone with COVID-19 in the past? Have you had a fever, sore throat, cough, loss of sense of smell or taste in the past few days? And have you traveled outside of New York State or the country in recent weeks? If you are a new patient calling to make an appointment, we ask that all paperwork be completed prior to your arrival in office. And there are actually several ways that that can be done. The first option would be to complete the paperwork on our NYHD website, which can then be forwarded to us through email. The second option would be to print the paperwork at home. And then again, that can be scanned and emailed to us, or you can bring it with you in our office when you come to your scheduled appointment. And the third option is to fill out the paperwork in office if you don't have the ability to fill it out before you come in for your scheduled appointment. We also ask that all insurance cards and referral sheets be emailed to us before you come in for your appointment. And again, we can accept a quality picture. We also advise that you do not bring any significant others with you to your appointment unless it is absolutely necessary. And finally, and most importantly, we ask that, and it is mandatory, that all patients wear masks to their appointments.
Thank you, Dr. Naeem. And I think it's important for everybody to understand that we're taking these measures to try to reduce the amount of time that you're spending in the office. It's important for you, it's important for us, it's important for any other patients. And we're going to talk to Dr. Alexandra Zweig in a second about what's going to happen when you're in the office. But all those measures we're putting in place just to limit the amount of time that's required for you to even be in our physical space. Absolutely. So thanks, Dr. Naeem. Appreciate that.
Of course.
We'll see you soon. I'm going to take you off the screen for a second. So now next up, I have Dr. Alexandra Zweig. She's going to talk to us a little bit about what's going to happen once you actually reach our office and what's going to happen in the four walls. So where's Dr. Zweig? There you are. How are you, Dr. Zweig?
Good. How's everyone doing?
Great. I'm going to back out here. I'll let you talk for a bit.
All right. So I'm going to be talking about what happens when you arrive for your appointment. So when you arrive to our building, we're going to ask you to call the office to alert us that you're in the front of the building. So your audiologist or your doctor or our doctoral resident will come downstairs and let you into the building and then escort you upstairs. So just keep in mind that this is our building that controls the front door. So we are working around building protocol. So once you're guided into our office, there will be an area in the front of the entrance for triage. There will be some visual alerts via signs or posters at the entrance to provide instructions about hand hygiene, respiratory hygiene, as well as cough etiquette. You must be wearing a mask or face covering. If you do not have a mask or face covering, a surgical mask will be provided. You will be asked to then sanitize your hands at entrance, and then basic COVID-19 intake questions will be repeated again for confirmation. If you answer yes to exposure to any of those questions, we will ask you to reschedule your appointment. We will then take your temperature. If you present with abnormal temperature at that time, you will be asked to reschedule as well. So once you pass that initial screening, you will then be escorted by your clinician into the appropriate room for your appointment. And this whole protocol is really to minimize any chance that you will need to wait for an appointment and to ensure that you will be seen on time. So finally, we do ask you to show up on time, so not too early and not late for your appointment. If you do show up late to the appointment, unfortunately, we will have to reschedule the appointment.
Excellent. Thanks, Dr. Zweig. Appreciate that.
My pleasure.
I'm going to take you off the screen. So this is going to be a short one, everybody, today, but we really wanted to give you some valuable information about everything that we've been working on. I'm just going to finish up with some new initiatives that we've accelerated in our practice and also some things that we've developed as a result of what's been going on over the past couple of months. So we talked a little bit about the paperwork in the office. We're going to work to achieve zero paperwork and also to streamline the check-in process for you. So we're starting to work now with a HIPAA compliant system. It's a complete privacy compliant system. As long as you have an email, you'll have everything that you need. So that will be very, very simple if you have to fill out paperwork as a new patient or even updating paperwork as an existing patient for us. All of your intake forms, as I said, as well as hearing aid contracts. So if you're a hearing aid user currently and you wear hearing aids, part of the process of obtaining a hearing aid is a formal contract between yourself and our practice. So all of that will be electronic as well. And there's a lot of benefits for that. Again, first, there's less time in the office, and it's more convenient also because you'll have copies of everything electronically for future reference at any point in time. So you'll always have copies of any paperwork that you send to our office. Something else that we've been working on significantly over the past couple of years, but have kind of ramped up our efforts in recent times, is the further development of our fall prevention program, as well as our balance assessment services. So we are NYHD, Institute for Hearing and Balance. We are the only private audiology practice in the area offering certain specialized testing to really gain a full perspective on what might be causing someone's dizziness. So we're really proud of the things that we've done, but we're also working very hard on helping to prevent falls. And that's something we'll be kind of unraveling in the next month to 2 months or so for anyone who might be concerned about falls, which is pretty much all of us at some point. We've also developed a really, really strong relationship over the past year or so, a collaborative program with with literally the largest physical therapy practice in the New York City metropolitan area to provide seamless care from the diagnostic component of balance assessment all the way through rehabilitation. So we've been working hard to make sure we can do that in a safe way and get you to the places that you need to go without wasting time and have unnecessary appointments. That's really what it's about nowadays, is limiting the exposure times in the office. One more thing that I did want to share with you also is our remote hearing aid care program. We've been doing remote hearing aid care for a little over a year now, and we've offered some components of this, but clearly this has been very much accelerated over the past couple of months. So what this system allows us to do is provide you with remote face-to-face troubleshooting and adjustments to many of the newer hearing aid technologies. So if you have older hearing aids, unfortunately, there's a chance that we might not be able to link up with your hearing aid remotely. But if you're curious if your specific hearing aid technology has this capability, just reach out to us and we'll be happy to take a look and kind of guide you on the right path and give you all the information you need to know. So there are some services we could do remotely. Others, unfortunately, at this point, we will not be able to do remotely, specifically as it relates to things like hearing testing. So those you'll still have to come into the office for. But again, we have all the proper measures in place to ensure that your visit is safe and that you're on your way quickly. Going forward, just to quickly go back regarding the hearing aid technology, going forward, any patients who are dispensed with newer technologies in our office will have these remote capabilities built in. It will be automatically turned on. So if for any reason you cannot or you do not desire to come physically into the office, we'll have the ability to work with you remotely. So this is really exciting for us because, and we're finalizing another component of this is the actual dispensing of hearing instruments remotely, which will include, and we haven't talked too much about this, but we're looking at same-day messenger services within and around Manhattan, and a couple of other really interesting things that I'm not going to share at this point, but just keep in mind that we're trying to make this as easy as possible for everybody, and we're going to unveil some more details in the upcoming weeks as well. One fun thing that I did want to finish on is another effort that we put out there and we launched at the very beginning of the shutdown was our YouTube series called The Audiologist at Home. As a team, we decided that one way to contribute and help was to provide answers to common questions that you as patients face on a day-to-day basis regarding your hearing or balance-related issues. So those topics that we answered, quick videos, anywhere between 5 to 10 minutes, ranged from basic hearing aid care topics to more in-depth conversations about things like dizziness and tinnitus. They're super informative videos. It's a library that we've been hoping to develop for a long time. I also think they're quite entertaining at times as well. So all of that's going to be on our YouTube channel. I'm going to pop that name up there quickly for you now. It's NYHD Hearing and Balance if you have a chance to go over to YouTube. And many of the links to the videos actually appear in our Facebook feed as well. So with that said, I actually see one comment here. Let's see. Will you be sending us your new protocols in an email so we can have them? That's a wonderful question. So our intention is to actually have this video on our website. It's going to always be available on our YouTube channel and also on the Facebook page as well. But what we're going to be doing is putting these in a document form on our website. So within the next week or so, you're going to see all these protocols. And for anybody who calls to make an appointment, we'll be actually walking you through the process and talking you through it. So there'll be no questions once you reach our door in terms of what we're hoping to achieve and what we will achieve to keep everybody safe. So I appreciate that question. Thank you. And with that, that was just a quick review of some of the steps that we've taken in recent weeks. We've been working really hard behind the scenes to ensure that you will have the care that you need in a safe and convenient manner. We're going to continue to make innovative adjustments to our practice as the weeks and months move forward. And we're going to definitely do our best to keep you informed through this mode, but also on our website and in writing. And as always, if you have questions, please feel free to reach out to us at any time. You have our phone number. It actually, let me put that across the bottom one more time. Let's see here. Technical difficulties. There we go. So there's our email and our phone number and the website across the bottom there. On behalf of Drs. Zweig, Dr. Naeem, and myself, really want to appreciate you guys taking the time to join us today. And most importantly, thank you very much for being a part of our family and trusting us with your care. We're going to begin welcoming patients in the upcoming week or so. We're really working hard to make this happen for you guys. So we really look forward to seeing all of you soon. And actually, there's one more question here. Let's see if we can do it on the fly question and answer. I'm going to bring Dr. Zweig and Dr. Naeem back in. So there's a question, suggestions. This is actually I didn't realize this was going to turn into an audiologist at home episode, but we're going to do it for everybody, a live one. Are there suggestions for wearing masks with hearing aids? Mine always come out of my ears when removing masks. This is something clearly that all of us are facing right now, especially when we wear behind the ear hearing instruments, which about 85 to 90% of patients wear behind the ear hearing devices. So either one of you guys have an answer to that question, suggestions for wearing masks with hearing aids?
Well, there are some masks which we are in the works of trying to get some actually, so we'll have to let our patients know if that does happen. There are some masks that do not go around the ear, but actually go around the head. So we're working on getting those made, and hopefully we can help. But any mask that goes around the head and does not loop around the ears would be my suggestion for mask use. So if you can find them online, or if we're able to get them for you somehow, we're definitely working on that.
Definitely agree with that.
I think we all concur. I think it's about the mask style. I never thought in my lifetime I would be talking about styles of face masks, but of course it is very, very important when we're talking about wearing multiple things over our ears, whether it's eyeglasses and hearing aids, hearing aids, mask. It definitely has an impact, and we have to be much more mindful of potentially losing hearing aids. One initiative that we're putting out there is a hearing aid lost and found for anybody who finds a hearing aid. As long as we can get a hold of the hearing aid, we can take a look at the serial number, check with the manufacturer, and ultimately get it back to its rightful owner, whether they're a patient of our practice or anybody else's practice. This is actually something that we wanted to put out there into the general public, and we will be in the upcoming weeks and months as well. So we do not have any other questions, but I'm glad that we were able to answer a couple of those. So thanks, Dr. Zweig. Thanks, Dr. Naeem. I appreciate everything you guys are doing and have done for the practice and also for all of our patients. And until we see you guys next time, be well, take good care of yourselves, take care of everybody that you love, and please reach out to us with any questions. So have a great day, everybody. Thank you.
Bye, guys.
Bye.